Now, within the integumentary system, the skin, the areola, the linea nigra, all these chloasma, all these pigment changes are in relation to hormonal changes. And main thing is the patient needs to be reassured that after pregnancy that these things will go away. The only integumentary change that is not guaranteed to decrease or go away is striae gravidarum or stretch marks. They may decrease in intensity, but they may still be visually perceptible. Also with nutrition, remember that the metabolic rate is going to be going up because all of the systems, all of the body systems are working overtime. Their demand has been increased for their work, so they're going to need extra nutrition, extra metabolism going to keep all that functioning. So weight gain of 20 to 25 pounds, that's going to be a key one. You'll see, just almost guarantee it, what is appropriate weight gain during pregnancy. Or it may be presented that a patient has gained X number of pounds, and is this appropriate? So total weight gain of 20 to 25 pounds. With a high protein diet, good adherence to using the food pyramid, good well-rounded diet is what we want. Don't forget that pica, the craving for non-nutritive substances, we see that a lot in the second and third trimester, should be addressed with telling the client not to do that and to be sure to eat a well-balanced diet. The cardiovascular system, this is also a very important area to be aware of, the physiological changes, because this will impact changes with cardiac defects, pregnancy-induced hypertension that we'll discuss later on. But cardiac output increases about 30% during pregnancy, and the blood volume, circulating volume, will increase and peak around 30 weeks at almost 50% of an increase above pre-pregnancy levels. That increase in volume is circulating volume. So it will give the laboratory findings of a pseudoanemia, meaning that it's hemodiluted is what has happened. So we just want to be sure that the H&H remains at 10 and 30 would be an appropriate non-anemic level. And of course, pulse rate, because we're having to circulate extra volume, we have increased oxygen needs, that we're going to increase pulse rate by 10 to 15 beats a minute. And that the blood pressure will drop initially because the vessels will vasodilate in preparation for that volume, but the volume will not come as rapidly as the vasodilation. And so we will have an initial drop in blood pressure, and then it will come back to pre-pregnancy levels. We should not have an increase in blood pressure. And this is brought on by changes by progesterone. The uterus, that is our garden for this baby, our environment, our growing ground, and it's highly influenced by estrogen and progesterone. It'll increase its capacity by 500 to 1,000 cc's of volume. And then with endocrine, we're going to see increased activity of the thyroid. Obviously, we have a higher metabolic rate. Adrenal cortex, pituitary, everything is going to be put into overdrive, if you will. The other endocrine change that you'll see at the second and more so in the third trimester is the production of relaxin, which causes joint and back pain. And this is where we would be doing teaching about the pelvic rock, standing really nice and tall, low heel shoes, those kind of things.